Hello, I'm Mary Helen Hackney, and I am a medical oncologist at VCU Massey Cancer Center. I'd like to welcome everybody to our third annual Myths About Cancer. This has been one of our most popular monthly lectures. That's part of our integrative health program, where we have a monthly lecture or discussion on some topic that we feel is very important to men and women who are going through cancer treatment or who have had cancer or might be at risk for cancer. We are glad you're joining us today. We have three speakers, myself being one of them. As I said, I'm Mary Helen Hackney, a medical oncologist. Also joining me will be Mandy Gatesman, who is an oncology pharmacy faculty member and is in charge of a lot of our chemotherapy development and protocols. And Allie Farley, who is a nutritionist, registered dietitian and nutritionist, who leads a lot of our classes on nutrition for our cancer patients and is a great resource about what makes sense to do with diet and keeping our bodies healthy, because that's really a key factor as we fight cancer. So I'm glad to have my colleagues here. We are missing having you in front of us, which is how we usually do it, but we're glad we can reach out to you through the miracle of the electronic world these days. This will also be posted, so you'll be able to see it at a later time. So I get to start off here with talking a little bit about cancer myths. And the first thing I've got to say is the first myth is that everybody who gets cancer is not going to die of cancer. And it's really good to be able to say that out loud right now, because data came out, a big publication in the past few months, that showed that cancer death rates are actually dropping. And so we have our lowest incidence of people dying from cancer right now. Now, the number of people getting cancer is about the same, so that's kind of stable. But people dying of cancer is dropping, which we think is probably due to a couple of things. One of them is early mammograms, early detection, more screening, people paying attention to getting their colonoscopies, their mammograms. Also, a big factor is less tobacco use. Particularly in men, we've watched lung cancer death rates drop. And so getting cancer does not equal death. So that's the first myth to get rid of. Catching things early, doing good health behaviors to reduce your risk, all of those things are sort of key factors, because we don't want cancer to be the cause of death. We know that about 1 out of 2 men are going to have cancer in their lifetime. About 1 out of 3 women are going to have cancer in their lifetime. But that, again, does not mean that that's what they're going to die of. Unfortunately, heart disease and all its associated morbidities are still the biggest killer in the United States right now. So then I start to think of what other cancer myths people say. Well, my family doesn't have cancer in it, so nobody in my family has cancer, so I'm not going to get cancer. Unfortunately, many people who get cancer have no family history. The biggest risk factors for most cancers is getting older, which we can't change. We know that cancer is predominantly in people over 50. So again, just a family history does not mean you're not going to get cancer. So you got to pay attention to what screening tools we have out there right now. I think when people do sometimes find something that worries them, they're worried about, can they make the cancer spread? And so somebody may find a lump in their neck or a lump in their bosom. And they go like, oh, if somebody biopsies it, then, or puts a needle in it to try to take a sample, that's going to make cancer spread. But there's been a lot of good research that says that, no, that's not going to make cancer spread. And the only way we can treat cancer is really to know what it is. So the people who do biopsies, the radiologists, the surgeons who do biopsies, are fully aware of how to do a sample of that lump or bump, or if they're going in to do surgery, or if they're going in during a colonoscopy and taking out cancer that way. They know how to do that to minimize the risk that it could lead to spread. But we don't find that like sticking a needle in it or doing appropriate surgery makes cancer spread. We think that maybe some of that came from some very old time surgery where people would open up, would do surgery to go after, let's say, a colon cancer or pancreatic cancer, and it was so bad they couldn't do anything. So they just sewed the person up and said, there's nothing we could do. And then the patient died of cancer. So people thought, oh, that opening up made it spread. Nah, it was already spreading. So the surgeon didn't make it worse. And so if you find something, or if your loved one finds something, get the right test done, because if we can find it early, then we can put you into that not dying from cancer group, which is the best part of things. On that same thing, people get scared of treatment, and they think that all cancer treatment is bad, and that you're going to get sick, and that you're going to throw up, and that you're going to lose your hair. Well, I'll tell you that we're better and better about treating cancer. We've got better drugs. Many of them don't have many side effects, and I know Mandy may talk a little bit about this, but the drugs are better. The recipes or the regimens that we use, the combinations are better. Many people who get treatment are able to still keep working, still keep taking care of their families. They're not, the goal is not to be in bed. The goal is to be living life. Two of the best things that have helped us really now is the development of things called portacasts or IV lines to help us give the drugs safely, and lots of types of anti-nausea medicines. And Mandy may talk more about that, but it has made a world of difference that we can have people get through chemotherapy doing well. And so don't be fearful that chemotherapy is going to be bad and it's going to get you into all kinds of trouble when you start getting treatment. Now, a lot of things that we think about are, how do I not get cancer? How do we reduce our risk? There are a lot of things out there that people say cause cancer. And there are a lot of things that people think cause cancer, but don't really. Okay. So let's dispel a few of those myths of what might cause cancer. One of the things that's a myth in my world as a breast cancer doctor is underwire bras, or even just bras in general. Bras do not make you get cancer. So if you need to wear one, wear it. And you can wear whatever kind is comfortable for you. So that's a key factor. Cell phones. Everybody's worrying about cell phones, and how many electronics do we all use these days? Cell phones have been touted to cause either brain cancer because you're holding it to your ear all the time, or testicular cancer because the guys are carrying it in their pocket. And no data on either one of those. So you can use your cell phone safely, so don't worry about it. We worry about electrical power lines, big high-powered lines. Haven't found any data to say that causes cancer. Take that one off the list. One that is still under investigation is plastic bottles. And there's been some debate that certain types of plastics may lead to cancer. And so that's looking at bottles that are have certain plastic content. It's still a little bit iffy, but people are certainly thinking about it. So if you think about what else, what could cause cancer, and I'll let Allie talk a little bit about nutrition and foods. I was going to think about some of those other risk factors that people talk to me about. Deodorant. Deodorant is not a cancer causer. So that's another one we hear, is that if you put deodorant on, that's going to get into your lymph system and cause either breast cancer or lymphoma or something like that. Nah, not a risk factor for cancer right now. Probably the newest risk factor, there is a type of breast implant that some women got in the past to accentuate their bodies. And there is a tiny risk of a type of lymphoma from that, but it's not the majority of breast implants. And that means talk to your plastic surgeon if you have an implant that you have a concern about. Let's think of what other things that people think might cause cancer here. No, those are some of the big things that I think about. Because everybody always asks, what else can do it? What else can help you? Teflon pans. People have asked about Teflon pans. Nope, that doesn't cause cancer. They've talked about GMO foods, genetically modified foods causing cancer. Nah, and I think Allie can speak to that even more. Organic, so artificial sweeteners causing cancer. Nah, not on that one either. So there are a lot of things that people purport. Again, the biggest causes of cancer: getting older, smoking, and obesity. And so those are things that we're finding: tobacco use, obesity, getting older. Some of those things you can modify, some you can't. Okay. So those are things to really be thinking about. I'm just checking my time in terms of reducing your cancer. Um, uh, Other things I think about with cancer, do people worry that cancer always causes pain? No, cancer doesn't cause pain even early on or later on. And we are, again, have so many more tools at our fingertips to try to keep people comfortable if they do have recurrent cancer. So be thinking about that as we're trying to make people live well and live longer with cancer. Don't be worried about, what if something happens. Be honest, open talk to your doctor. Let them know what's going on. Let them know what you're taking. Let them know what your worries are, because then we can work together to get that best recipe. Because there's a lot of stuff on the internet. If you Google out cancer, you're going to find all kinds of things. Like people to look at a website called cancer.net. It's from our National Oncology Group, and it's got great information, well researched, well vetted, and it links you to good places, because sometimes you follow some things out, and there's some people who say some very strange things out there about cancer. And so you need to know that we do have some good resources that you can look at. So that's probably the one I send most patients to on any cancer. And there's information about all types of cancer and survivorship and wellness and prevention of those things. So please do think about that as we go from that. I know Allie's going to tell you there's no magic anti-cancer diet. I wish I could tell you there was, but we all would like to see that. I'm just sort of double checking some of those things that I hear about. Some people say, well, what happens if I'm pregnant? Can I get treated for cancer? If you're pregnant, you can get treated for cancer. We have to make certain choices about drugs, but for most cancers, we can find something that'll help control the cancer during pregnancy. Some people say, well, I'm too old for chemo. Well, it really depends on the type of cancer, because we know that some cancers, like chronic lymphocytic leukemia, occur mostly in 70 and 80-year-olds. But there are newer medications that can be used even if you're older. So age is not an absolute cutoff. We all know people who are 60 who act like they're 80, and 80-year-olds who act like they're 60. So we really look at the whole patient and try to determine what's the best treatment choice for them. So when we talk about chemotherapy or hormonal therapy, or immunotherapy, we're looking at that whole patient. Similarly, there are lots of myths about radiation therapy. It's always going to burn you. It's going to make your skin turn funny colors. It's going to cause more cancer. It very, very rarely ever causes more cancer, but the newer radiation techniques are, again, so much improved over 10, 15, 20 years ago that people can tolerate it very well. And they're using a lot more what they call focused or stereotactic techniques, so that they have less damage to the whole body or to that area of the body. So again, ask good questions. Don't run away before knowing the answers. And that's really a key factor in terms of you living well before, during, and after cancer. And wellness is one of the things we want to focus on, which is why we put this integrative health program together. Take a look at our website, and you're going to see all kinds of programs that are focusing on wellness and health during and after cancer care. So those are a couple of things I'm thinking about. So we got a few people watching, and I know people are going to look at this later on. Probably the only other thing is that, people sort of get worried that we're keeping things from them. They're saying that, oh, the cure for cancer is out there, and big pharma and everything is keeping it away. Believe me, if I could cure cancer and I could go back to, I don't know, taking care of high blood pressure or something like that, I would do it. I would love not to have to tell people that they have a difficult disease. But the thing with pharma right now and the thing with our government is we're finding new treatments every day. Last week, I wrote for a new drug that I could not write for 2 months ago. And it's going to hopefully make a difference for this person. So the new treatments are what is making a difference in people doing this kind of research, being part of clinical trials. Another myth, if you're on a clinical trial, it means there's nothing left to try. Clinical trials offer lots of opportunities. Clinical trials could be early on in your disease. It could be late on in your disease. It could be about the surgery. It could be about the radiation. It could be about the medications. But sometimes it's adding something new that might give an added benefit. So don't worry about clinical trials if offered. Ask questions, be your own advocate. And I think that's one of the really key things I want to leave you with is that I'm going to turn it over to Mandy Gatesman here, who can talk more about pharmacology and drugs and all those things. But recognize that there is a lot we can do, and we can only do if we ask questions and we have a dialogue. So we get your team together, surgeons, medical oncologists, radiation, to help eradicate those myths and look towards long life and long life living well. Mandy, I'm going to turn it over to you and talk about drugs here, or chemicals, or anything like that.
Anything, yeah, thank you. And I'll piggyback off a lot of what Dr. Hackney was just talking about, since we do overlap a lot. So start with some of the same things about, side effects of chemotherapy that, everybody always is worried about, the nausea and vomiting. And I think that that's probably like the biggest thing that's changed over the past probably 20 years is the toolbox that we have of chemotherapy, or of anti-nausea and anti-vomiting medications that we can use. So we're so much better about controlling nausea and vomiting than we ever used to be. And we keep making small incremental changes that make it even better and even better. So I think that, people oftentimes will say, well, I watched my grandmother go through chemotherapy. And I know that she, was very ill and very sick, and I just don't want to go through that. And I would just say again, like Dr. Hackney was talking about, having these open discussions about things have changed so much with supportive care, the taking care of those side effects and stuff that come along with chemo, that it's a different ballgame now than it used to be. So please don't, let one other person's experience, either in your past or someone that you know currently, because every patient is different, every cancer is different, and the way that even the one drug, might affect one person can be very different from another person. So I think that, trying to keep your eye on your own prize is helpful, because it's hard to compare across people whenever it comes to, especially over time, that we're so much better now at controlling some of the side effects than we used to be, and particularly nausea and vomiting is, I think, usually on the forefront of people's minds whenever they first talk about chemotherapy. And then, some of the other side effects, we have moved over the past, again, probably 10 years, maybe 15, much more to what we call like targeted treatments, where before we used to kind of like, and we still use, they're still very, very useful drugs, where, they're a little bit more of like a big carpet bomb, where they're not really smart enough to say this is a cancer cell and this is a healthy cell. I'm just going to kill all these cells. And so that's where a lot of those kind of side effects come from. We've gotten much smarter to be able to say this particular thing is driving this cancer, and so maybe we can just target this thing. And so by being able to target particular parts of a cancer cell, it does help to minimize some of those side effects of what people used to experience previously, where we can really kind of target. They don't come with no side effects. That's certainly not true, but they just have a different set of side effects that, again, we're much, much better about managing and recognizing and monitoring for along the way. And then I know immune therapy has really changed the whole landscape of cancer treatment. Since that came out, and it's probably only been, within the past 10 years that we've had, and that has exploded and really changed the paradigm of cancer treatment. So we have so many more different ways that we can attack cancer from a drug perspective, that it's really exciting, and it's really worth getting all of that information about the options that you have, rather than clouding your judgment from somebody else's experience many, many years ago, because we do things a lot different now. It's really exciting to watch the field of oncology improve over even the relatively short amount of time that I've been in practice, which is, coming up on like 15 years now. It's changed drastically. So it's really exciting, all of the different, options that we have. And a lot of that does come down to clinical trials, like Dr. Hackney was talking about. So we love to promote clinical trials, and, it just helps to move the science forward while also helping you as an individual with your particular cancer. I think my video. Oh, there we go. Okay. So that's some of those. One of the myths that I have talked about in the past within integrative health is herbals and how that interacts with chemotherapy, and can I be on herbals, or feeling like you have to pick one lane or the other. Either I do the herbals and I don't do what I would call like traditional chemotherapy, or if I do traditional chemotherapy, I can't do the herbals. And that's not true. We have data that shows that as long as you're accepting the traditional treatment options of surgery and chemotherapy and radiation, herbals can be added on top of that, usually in a safe way. We like to know that, though, as your healthcare team, because there are some interactions that can occur with herbals and chemotherapy. Just because they're herbals doesn't mean that they're, just because they're natural doesn't mean that they're completely without side effects or completely without interactions with with the other treatments that you might be receiving. So again, open dialogue with your healthcare team to make sure that they know what your goals are and what other things that you're considering as part of your holistic cancer approach, so that we can make the best decisions together. So again, most of the time we can use herbals at the same time as some of our other treatments. Sometimes there will be some interactions where we'll say, hey, can you save this one till after you're finished with this chemotherapy because it might increase side effects or something. But again, just making sure to talk about that with your providers so that we can understand, everything that you got going on. And other things, I will open the can of worms a little bit about COVID vaccines, about whether or not cancer patients, and I'll just kind of generally say cancer patients in all vaccines, in that cancer patients can receive vaccines even when they're on treatment. Not all vaccines. There are some vaccines that are live, meaning that they actually have a piece of the virus that could actually make you sick. But that's a very small number of vaccines that we have. And the flu vaccine is not live, so you can get the flu vaccine during your treatment. And we always recommend that you do, because even if you don't mount a complete immune response as someone who was not receiving chemotherapy, you could mount enough of a response to potentially, if not completely prevent yourself from getting the flu. If we're talking about the flu vaccine, it could at least make your, if you get the flu, it could make your symptoms more mild, which is important whenever your immune system is low too. So, so we still recommend that you get vaccines, particularly for the COVID vaccine. We certainly don't at this point have data in a cancer population. Those patients were not included in the current vaccine trials that we have. But recognizing what we do know about vaccines in cancer patients, where we do have a lot of data, particularly like the flu vaccine, we don't anticipate that there should be any additional concerns for a cancer patient with these types of vaccines. So they are not live. They do not have, like the real COVID virus. So you cannot get COVID from the vaccine. So from a safety perspective, they should be safe. Whether you would have the same immune response, and so therefore the same protection as someone who did not have cancer or was not receiving chemotherapy, we don't know that for sure. We think you probably would not have the same level of protection, but that doesn't mean that you won't have some protection, and some protection is likely better than none. But it wouldn't, by getting the COVID vaccine, it wouldn't all of a sudden be able to throw all of your masks away and go back to like normal. We would still recommend that you do all the same precautions that are currently recommended: masks, social distancing, washing your hands, all that good stuff, because we know that the immune response in a patient receiving chemotherapy would likely be less. So we want to make sure that you're still protecting yourself with those other means. But at this time, if it were me and the COVID vaccine were offered to me and I were on chemotherapy, I would certainly have that discussion with my oncologist about, the pros and cons of it, where you could potentially time it within your chemotherapy regimen to give you the best chance of having the best immune response. But I wouldn't just put a lock and key on it and just say no, 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 because I don't know what it's going to do in a cancer patient. I think that we have enough data with other vaccines that the conversation is worth having. I think that's all the myths that I got to talk about for right now. I'll toss it back over to Allie, and she can talk about some of the nutrition stuff.
Thank you so much, Mandy. I want to start out by really acknowledging we can all be victims of misinformation regarding nutrition from the internet. Perhaps loving family and friends whom are just trying to help, yet are not experts in the field of nutrition or medicine, might give us some false information that they feel is helpful, but isn't always helpful. Going through a cancer diagnosis and treatment is life-changing, and our goal as team members at Massey is to help individuals really navigate through the process. And one of those processes, as we've mentioned a couple times already today, is understanding food while also obtaining and maintaining a healthy nutritional status. Misinformation of food can sometimes lead to disordered eating patterns or fears of specific foods or even an entire food group. Deciphering information that is considered evidence-based compared to information that is someone's opinion or backed by little science can really be difficult. Reducing food fears by asking your healthcare team questions prior to following any nutrition advice and diet can be helpful. So I always encourage patients, family members, and friends and caregivers to learn the facts and not become overwhelmed with the large amount of misinformation around oncology and nutrition by using their medical team as their #1 resource. With all this being said, there are some nutritional myths regarding oncology nutrition that I feel like stick around. As many times as I've talked about them, they never seem to fade away. And one of those being sugar. So does sugar feed cancer? I feel like I'm still asked this question all the time. It's not always worded that exact way, but I'm always asked about sugar. So at this point, it has not been shown that eliminating dietary sources of sugar and carbohydrates actually results in a slower growth of tumors. In regards to sugar and cancer, I like to really identify the difference between natural sugars and added sugars first. So natural sugars are found in a lot of our health promoting foods, like dairy products, which has lactose, a form of sugar in them, our fruits and vegetables, which has many types of sugar in them, as well as whole grains. And then we have what's called our added sugars. These are your table sugars that you might add to your coffee or tea, or maybe your baked goods and your sweets, and are found in a lot of our beverages, which have a lot of added sugar in them. In regards to sugar and cancer, I think there might be an indirect connection, not a full connection of sugar feeding cancer in relation to our diets, because a diet typically high in fat, calories, and added sugar can lead to obesity. We currently know that there are 12 cancers that are linked to obesity. So indirectly, can added sugar play a role in cancer? There is a connection there in that avenue. So being aware of how we can reduce the amount of added sugars in our diet is important, but still include those natural sugars. Natural sugars, or sugars in general, are carbohydrates. Our bodies use carbohydrates for energy. We need energy. So it's important to include those natural sugars or those healthier foods in our diet by restricting the added sugars. Actually, the new dietary guidelines for 2020 and 2025 were released this month. So the new recommendation for added sugar is less than 10% of our daily calories. So if you're looking at a 2,000 calorie diet, that's going to be about 200 calories, which comes to about 12 teaspoons of sugar. So you want less than that per day. The American Heart Association actually recommends 6 teaspoons or 100 calories for women and 9 teaspoons or 150 calories for men. Now this is that amount or less. They don't want you to reach that amount if you don't have to. So really being aware of what type of sugar we're including in our diet and just making healthier choices overall. Another question I feel like I'm asked a lot is about soy. specifically in regards to the risk of breast cancer. So soy has gotten a really bad rep, which is really a shame because soy is a really healthful food. The concern with soy is phytoestrogens that are found in soy, and it's that word estrogen that makes things really blurry and kind of scary because of the concern of human hormone estrogens and the risk with breast cancer. So phytoestrogens do not act the same way in our bodies as human hormone estrogens. They're actually really a good source of protein in our diet and a good healthy food to include in our diet. So I encourage soy in your diet. 1 to 2 servings is completely safe. However, I want you to pay attention to the types of soy you're eating. Whole soy foods are best. So that's going to be your soybeans, your edamame, your tofu, soy milk are all whole soy products. If you're buying a product and you're wondering if it has a whole soy in it, look at the ingredient list. Those lists that say partially hydrogenated or isolated or partial soy are not going to be the best choices for us. Not because they're extremely harmful. They are processed, so it's not a whole soy, so it's not the best choice, but it's not going to provide all the health benefits that a whole soy product is going to provide. Also, soy powders or supplements are not encouraged. It's the whole soy product. 1 to 2 servings a day are completely safe. So feel fine including those in your diet. Another question, which Dr. Hackney brought up briefly, is tell me what the cancer curing diet is. I want to know what I need to eat to cure cancer, to prevent cancer. I just want to know what I need to eat. And sadly, there is not that diet out there. Now, there are some recommendations set forth by some really reliable resources. The American Institute for Cancer Research encourages a plant-based diet. Now, this is for cancer prevention, possibly cancer reduction, as well as just an overall healthy lifestyle. So it's not just for cancer, but to prevent obesity, diabetes, heart disease. A plant-based diet is what is encouraged. So what is a plant-based diet? Well, it's a diet that can include fruits, vegetables, whole grain, plant-based protein, as well as lean choices of animal-based protein. But it's looking at your plate differently. The method set forth by the American Institute for Cancer Research is called the New American Plate, where you're looking at your plate where 2/3 of your plate or more is full of plant-based nutrients, while 1/3 or less can have your animal-based protein. So instead of your traditional plate that is surrounded by a large piece of meat and 2 side dishes, you have a plate full of plant-based nutrients and a side dish or a condiment of meat. But it also encourages portion and proportion of your food. So being aware of what a serving size is, being aware of properly cooking your types of foods, your vegetables, your meats, including whole grains. Make half of your grains whole grain, at least 3 servings of whole grain, incorporating more fiber, and even plant-based protein is important. Also, including exercise within this whole realm of eating well. I feel like exercise and nutrition go hand in hand. You really need both of them to have complete success. So talk to your care team about what exercise is best for you, either during treatment, after treatment, whatever it is. Just talk to your care team about what type of physical activity you can incorporate into your day. What I also like to talk about too is more recently, over the past 2 years, I've got the question that I guess I just didn't think other people were thinking about was during treatment, we want to not only eat well, but we want to optimize our nutrition. So sometimes with certain cancers, you might need more calories and protein. So that might not mean you're not able to eat all fruits and vegetables and whole grains and beans all the time. This might mean you have to veer off those healthier choices and meet what you need for your calories and protein and whatever sounds satisfying and palatable at the time. Because as Mandy was talking about, nausea and vomiting can occur. There are medications out there to help it, but it can occur, as well as change in smell and taste and a lot of different things. Appetite can occur. So making every bite count is so important. So as long as you're eating and getting nutrition, that's all that matters. Don't stress about not getting your 4 to 5 servings of fruits and vegetables every day, but make sure you're getting nutrition. And then I kind of wanted to lean into immunity. That's a question I've been asked a good bit over the last 10 to 11 months during everything with COVID. How can I increase my immunity with diet? What food can I eat to boost my immunity? Well, there is no one food or one supplement that can increase your immunity overall. It's really healthy lifestyle choices in general. It's not only consuming a healthy diet full of fruits and vegetables and whole grains and lean meats, but consuming a variety of those nutrients so you're getting lots of vitamins and minerals. It's also being active, as I mentioned. Recommendations for an individual is typically around 150 minutes a week of some type of movement or physical activity. It's getting rest. I believe the recommendations for sleep is around 7 to 8 hours a night. I don't always get that, I can admit to that, but I know trying to get as much sleep and rest as possible is good. It's practicing good hygiene. As we all know, wash your hands, and make sure you're practicing good hygiene. And then one I like to kind of add into that is being mindful and be able to be acknowledge of your stress and managing that stress and working with others to help manage your stress. I think your mental health can help with your overall immunity as well. So those are all really important in regards to immunity. Really, those are the top questions I get in regards to nutrition. There's tons of other ones out there. And I know we could probably talk all day about them, but those are the ones that I feel like I'm debunking the most often.
And I just wanted to piggyback one thing that Allie said about like the whole, the whole soy product and not like the supplements per se. And I'll echo that from an herbal and a natural product side as well. That, if like, don't take a garlic supplement, like put more garlic in your food. Like anytime that you can make those food sources rather than something that was made in a lab is probably always for the better. So, because you can get into some trouble with some of those products that, more is not always better when it comes to certain supplements. So, when you can, take those and turmeric and, some other things that I feel like I get asked a lot of questions about, put those more in your food products and maybe rely less on the supplement side for some of those.
Yeah. And I always like to tell patients that, mushrooms are very natural, but there are poisonous mushrooms that are very deadly. They're very natural, but they're naturally deadly. So, think about where things are. One thing that didn't come up this time, also that I'm hearing a lot is acidifying my body and changing the pH of our body. And I think all three of us would acknowledge that our bodies are designed to run at a specific pH. And if you drink all the acid water or all the alkaline water, or you start putting all these supplements in your water or whatever you do, your kidneys and your lungs are going to recorrect it. So you can't change that microenvironment to that level. But that's been one that pops up, and it's great moneymaker for whoever's making the products. But it's not helping your cancer or helping prevent your cancer. So
I feel that way about cleanses. That's what your liver does.
Yeah. Yeah. And
you have a built-in cleaner.
Yeah, you don't need to put yourself through all these cleanses and washouts and stuff, which can create kidney problems and get your bowels off balance so that you then have irritable bowel type symptomatology. Natural is, eating well is better. Mm-hmm. So that obesity issue is really the big thing. Allie mentioned, we're looking at breast cancer, pancreatic cancer, endometrial cancer, some of the other GI tract cancers, all are associated with obesity, particularly obesity over the age of 50. So if you reduce that sugar so that you are less obese, then that may really be the best way to make your diet better. So when we talk about reducing your risk of cancer, that's a huge one these days. So, are there any questions coming out from the audience? We've got a dozen or more people watching live, which we are grateful to you. I was just thinking of some other little odds and ends people have asked about. Somebody asked if hyperbaric oxygen will cure cancer. Anybody want to say anything, yay or nay? The answer is no. Excuse me. It may give you some other problems, but it will not cure cancer. It's best used for wound care in certain things. But there have been people taught it, there used to be oxygen bars and these things that if you get extra oxygen, that will help. Again, our bodies are designed to heal on what is in our world these days about wellness and healing and such. Anybody else? Mandy, Allie, any other things that come to mind that people have asked you about?
I will say too, and Mandy can probably help vouch me on this one. One of the resources I use a lot, because she's actually the one that told me about it, and I do tell some patients about it, is About Herbs. It's a wonderful resource to kind of learn about herbal supplements and kind of get you in a mind frame where you can then talk to your provider about the herbal supplement and get some reliable information. It's an app that I have on my iPhone. I believe it's available for Android. It's free. And then you can also find it online. And Mandy, maybe you can talk a little bit more about it. But
yeah, so if I have questions about herbals, including things like mushrooms and stuff like that, the best resources, there's two that I found are best. About Herbs, which is a site, it's a website as well. You don't have to do it via app. You can do it by a website too. That's grown and maintained from Memorial Sloan Kettering Cancer Center. In combination with like a botanist plus a pharmacist. And I'm not sure who else is on their committee that keeps it up to date, but they have, I think, the best information. It's very comprehensive. There's a lot of different herbals on there. They have it divided into two sections. One is for like patient information, and the other one is directed toward a healthcare provider. So it's the same information, it's just how they word it. So depending on how much information you feel like you can handle from one to the other, you can start with the patient one. And if you feel like you have, a decent amount of healthcare knowledge, you can check out the healthcare information part 2 and get more information. But that's the first place that I always go as well. It does have an app for iPhone. It is not yet available for Android as far as I know. There's another website that's it's done through you just caught me off guard. It's done through the NCI, the National Cancer Institute, but it's an offshoot of the National Cancer Institute, looking specifically at integrative health. And they have a website as well. And their app is good for both. They have an Android app as well as an iPhone app. I would say that their information is less. They just don't have as many herbal products on their site as what the Memorial Sloan Kettering site has. So I usually check both and just see what information that they have. But yeah, I think that talk about misinformation. I mean, certainly herbal products, there is a lot of misinformation, likely because they're not regulated the same as prescription drugs are. So people can create them and market them without a whole lot of oversight. And so, and they make a lot of money off of them. It's like a $5 billion a year industry or something like that. So it goes back to, I think Dr. Hackney said something along these lines of, if it's too good to be true, it probably is. That certainly plays into herbal treatments within the cancer realm too. And so you do get down that rabbit hole of, this person who says that they took this herbal product and it cured their cancer. Probably not true. So yeah, just making sure to find those resources that are good. And those are two great ones to go to. So yeah, thanks for bringing that up, Allie. Those are really good ones.
Thank you. I think another topic I forgot to bring up too was organic or non-organic in regards to our produce specifically too. There's a lot of talk out there that organic is best and that the pesticides and chemicals that we're using on our conventionally grown or non-organic produce actually can cause harm. But there is no research backing that. There's no research that says that any of those chemicals are causing any harm to us. There's no research that says organic produce is actually nutriently better. So honestly, what I like to encourage in individuals is really whatever you can purchase and whatever is most affordable for you. Buying organic can be very expensive. And then also buying fresh all the time isn't always attainable. Fresh food can go bad. So buying frozen and canned is okay. When you're buying frozen and canned, make sure there's not a lot of added seasonings or sauces to them. Frozen sometimes actually is a little bit better nutrient content than some of the fresh we're buying that's being shipped from wherever it's coming from, unless it's freshly grown here locally, because it's frozen right away. In regards to canned, just making sure that you're probably rinsing your canned fruits and vegetables, to rinse any type of salt that might have been added or sodium that might have been added for the preservatives or any extra juices or things that might be on them. Purchase them in their own natural juices as well is good. If you're having any GI complications, sometimes buying canned isn't best because it can kind of increase your GI complications, but just being aware that eating your fruits and vegetables is all that really matters. 4 to 5 servings a day is what's recommended. So that's from a dietitian standpoint, eat your vegetables. That's all that matters, fruits and vegetables. Let's see here. Also, I see a question here about hormones in foods. I know there's a lot of questions about the hormones that are used in some of our animal-based protein and things like chickens and things like that. There's no research right now that says that those hormones are causing any harm or can increase your risk of cancer or increase your risk of redeveloping cancer. So don't feel like you have to buy all organic or plant-based protein items that, animal-based protein items that have been have hormones or anything in them. Don't feel like you have to buy grass-fed, I guess is what I'm saying. So whatever is easiest for you cost efficiently.
Let's see. I see a question here about skin cancer, sunbeds, tanning beds. I have to go and look to see your general rule of thumb is you should not get more than 10 or 15 minutes of any type of exposure before you put on sunscreen. So I certainly do have some concerns about tanning beds. I have to admit, I haven't looked at the most recent data, but I can't see any good reason to try to look tanner with ultraviolet lights. We know that skin cancer is on the rise. Most of what we have done from our childhood is coming back to haunt us. That's why we can't get into dermatologist office. They have so many people to work on. So I think anything that protects your skin is the better things. That means moisturize. That means stay out of the sun. If you need to increase your vitamin D levels, go out in the natural sun for 15 minutes, a couple of times a week, then put on your sunscreen to help your natural vitamin D build up. That is where I would put that. I think people get very addicted to tanning sometimes, and it may look healthy in one way, but on the other hand, it's probably not so healthy. And if you want to not have wrinkles, you're not going to smoke and you're not going to tan early. Those are two big wrinkle causers. So if you smoke and you tan, then you're going to get wrinkles early. So then you have a whole other issue you have to worry about. So that's as we look at some questions that come up. Mushrooms. There's been a couple of things about mushrooms in different ways. The one thing I would say, there used to be a product that came in a plastic that was supposedly some sort of fungus that you made a tea with. They got rid of them because they were creating botulism, because it was some, one of those things like if you don't know where it's sourced from, don't do it. I don't know if there's anything else about mushrooms except know where they came from. As I said earlier, there are poisonous mushrooms in the world, so be careful of those.
Yeah, and I know that there are some within some herbal products and stuff as well that people have been using, but I don't know. I can't speak. I don't think to any particular species of mushrooms. But it would be this
one I hear about.
But it would be that I would have the same recommendation as I do about any herbal. If you're trying to get it through supplement form, is to just make sure, safety number one, where's it coming from? You know, there's a couple of herbal regulatory agencies that will certify a manufacturer that what they're manufacturing is actually in the product at the end of the day, that what they say is in the product in your bottle is actually in your bottle, because that they have found that a decent amount of the herbals on the shelf do not actually contain what they say that they contain, or don't contain it in the same quantity that they say it is on the label. So there are some places that will certify manufacturers for herbal products to say that, yes, we have inspected these products, we have inspected their facilities that are manufacturing them, and we say that this is a safe product. So I would say always look for those particular ones. So like Consumer Labs is one that does that. The US Pharmacopoeia is another one that does it. So making sure that you're seeing those types of labels. And then otherwise also making sure, you know, bringing it up with your provider of these are the, you know, your oncologist or your radiologist or your surgeon. These are the herbals that I'm taking. Is there any reason why this would be harmful in this, you know, in this treatment that I'm receiving? Because some, and I'm not saying specifically about mushrooms, I'm not, again, not commenting on anything specifically, but, you know, some things may increase your risk of bleeding. And so you might not want to do that around a time of surgery. Some things may interfere with your chemotherapy and might make side effects worse with your chemotherapy. So it's worth investigating each individual one.
Allie, do you want to take one of those questions?
Yeah, sure. There's a question about 3 to 4 cups of skim milk daily. Is it excessive for a 74-year-old woman? Well, I think excessive might be a little bit of the strong word in regards to the to that, but the recommendation for dairy is 2 to 3 servings per day, and this can be from milk, cheese, yogurt, whatever it may be. It is encouraged to choose a low-fat option, so a skim milk 3 to 4 times a day is probably okay. I would look at other dairy that you're getting in your diet as well. If you're getting a lot of dairy from other places, you might want to decrease a little bit, but I think it's probably fine. I wouldn't stress too much about 3 to 4 cups.
Great. We have another question about vaping. Vaping is still a habit that we're learning about. One of the challenges with vaping is that the substances that people are inhaling are quite variable. It is not simply water. It has heavy metals. It has a whole variety of other chemicals in it. Mandy, I don't know if you have anything else particular. Some of these chemicals are known to cause cancer. And the question is how much vaping is too much. Some people are alternating vaping with cigarettes, so you shouldn't be smoking in the beginning. That's the biggest thing to do. Is there is no good tobacco, so stop the tobacco. But there's so many different products in vape formulas that there is some cancer risk there. They have seen it in mice models. The other challenge with vaping is it can cause some pretty significant lung injury that's not cancer. And that's probably been the most serious thing we've seen with vaping. So it is not a safe alternative to smoking. It's a don't do either, is really the answer from all of us, I think. If you want to see some good questions, Fox Chase Cancer Center up in Philadelphia has got a very nice piece on vaping and risk of vaping. It's just 2 or 3 pages, so I would suggest you might want to take a look at that. But vaping is not safer than, you cannot say it's safer than smoking. It is occasionally used as a tool to get somebody off cigarettes, but only under a doctor's supervision, only for very short amounts of time. It is not a long-term supplement or not supplement, but substitute. So I do not encourage vaping. I don't know any doctor who does. But there's just so many chemicals in there and what people are inhaling in their lungs. And certainly, as I said, the lung damage has been significant in some people. So
yeah, and I'll just put a plug in there for smoking cessation in general, either from vaping, vaping still has nicotine in it. It's still going to be addictive, similarly to cigarettes. And so I think that if you need help, you know, if you're in the oncology world, ask your oncologist for help. They can help to put you on a path towards smoking cessation, whether that includes, you know, some sort of nicotine product that can help to wean you off of cigarettes or vaping so that, you know, you're not experiencing those cravings, and can help to taper you off slowly over time so you're more successful. Or there's other pharmacologic means, other drug, you know, other medications that can help in that time of tapering off of smoking, so they can help you come up with a good plan. So please, 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 it's never too late. Even if you have cancer, it's still not too late to quit smoking. There's some information that shows that, particularly in lung cancer, that if you continue to smoke, that it can adversely affect how well your chemotherapy works. It actually interferes with the way your chemo works. So it's never too late to stop. And so please have those open discussions with your providers about how you can create a plan to stop.
Very much so. Yeah, excellent. So I think we're probably getting close to the end of our hour here. So I would urge everybody to take a look at our integrative health website on the Massey Cancer Center website. We always have different activities, educational, interactive. Obviously, COVID has put a little bit of cramp on some of the things that we do, but we've been able to utilize electronics. So please, and there's great ways to ask questions. And we have a wonderful team of people at Massey who want to educate and help people. So let us know what your questions are so that we can build other programs that might help you. I ask you to look towards good health. Let's exercise. Let's eat well. Let's take care of each other. There's a lot of stress in the world these days. And as Allie pointed out about mindfulness and being able to try to get good sleep and reduce that stress in our lives, we know we're all going to be healthier for that. We know it's with COVID, it's a difficult time. So we should all, you know, wash our hands, keep our mask on, and give each other a hug. If we can't do it in real life, do it virtually, because all of us, it's going to take all of us to help each other. So I see my colleagues who I haven't hugged or sat next to in a while. So I reach out and do a virtual hug for everybody because we can all help each other at this time. So stay safe, stay well. Please let us know what we can do to be of service to you and your family. And hopefully we'll see you around our Richmond community. Bye, everybody.